Hi, my name is Timothy Ladd, and this is my presentation for Biology 163 on cardiac conduction. For the introduction, I'm going to explain the cardiac muscles and their role in cardiac conduction. The cardiac muscles are made up of two cell types: contractical cardiomyocytes and conductive cardiomyocytes, which are your pacemaker cells. The cardiac conduction system coordinates the organized contraction of the heart. It is responsible for organized sequential contraction of the heart chambers to efficiently pump blood throughout your body. This presentation will explore the structure and function of the cardiac conduction system, as well as how calcium regulates cardiac muscle contraction and the interpretation of EKG tracing on different types of cardiac conduction issues. Cardiac muscle tissue is made up, the bulk of it is made up by contractical cardiomyocytes. These cells are interconnected by specialized junctions called intercalated discs, which contain desmosomes and gap junctions. The desmosomes provide mechanical coupling between cells, while the gap junctions allow for the rapid spread of electrical impulses, enabling the coordinated contraction of the heart. For your cardiac conduction system, it is made up of the sinoatrial node, which I'm putting my mouse over where it is typically right now. Your sinoatrial node is essentially your heart's main pacemaker. It helps ensure your heart has a contraction, a heartbeat rate of 60 to 100 times a minute for an adult. It is located in the upper right atrium of the heart near the superior vena cava. And it generates electrical signals that cause the upper chambers of the heart, the atria, to contract. Your atrial ventricular node, or AV node, is located right about where the mouse is now. Its main function is to conduct the action potential from the atria to the ventricles. It is also a backup pacemaker in case your SA node fails. If it's acting as a backup pacemaker, it tries to maintain a heart rate of 40 to 60 beats per minute. The AV node also delays electrical signals from the SA node by a fraction of a second to allow the atria to empty blood before the ventricles contract. Now we're going to go to the AV bundle. The AV bundle of your heart quickly transmits the electrical impulses of your heart to the left and right bundle branch. And it results in synchronized contraction of the ventricles. It is essentially there to control the transmission of the heart's electrical impulse from the atria to the ventricles. The bundle branches of your heart are located where the mouse is right now, your left and right, and their main job is to conduct impulses to your left or right ventricles and the bundle branches. They can get something called left bundle branch block, a right bundle branch block, which essentially makes it where your heart's electrical impulses are not getting through correctly, depending on the severity of the block and the type of the block. It can cause irregular rhythms or your heart to have issues with cardiac conduction in general. And Purkinje fibers are specialized nerve cells that play a key role in your heart's conduction system. They send electrical signals to the heart's ventricles, causing them to contract and pump blood throughout your body. They are located in the subendocardial surface of the ventricular walls. It's part of your endocardium, the inner layer of your heart's chambers is where they're located. I'll move the mouse. It's going to be right here is the area they're located. Now, moving on, we're going to talk about pacemaker potential. For pacemaker potential, it is the conductive cardiomyocytes in the SA node. They have the ability to spontaneously depolarize, generating pacemaker potential. This is due to the opening of both sodium and calcium channels, which allow for the gradual and spontaneous depolarization of the cell membrane. Once the potential reaches the threshold and action potential is triggered, initiating the cardiac conduction process. I would like to add potassium also does play a role in this. Moving on, we're going to talk about contractical versus conductive cells. Contractical cardiomyocytes have a greater number of myofibrils, which are responsible for the mechanical contraction of the heart. Conductive cardiomyocytes, such as those found in your SA node, have fewer myofibrils, but a higher number of mitochondria, allowing them to generate the necessary electrical impulses. Additionally, conductive cells have a faster repolarization phase, enabling them to rapidly reset and generate the next action potential. This is a diagram of how it looks on an EKG, essentially. Now we're going to talk about calcium regulation of contraction. Calcium plays a crucial role in the regulation of cardiac muscle contraction. The entry of calcium through slow calcium channels into the cell membrane triggers the release of calcium from the sarcoplasmic reticulum, leading to the activation of the contractical apparatus, the subsequent rebutic of calcium into the sarcoplasmic reticulum facilitates the relaxation of the cardiac muscle. And now we're going to move on to what that looks like in the form of a neutral or a normal EKG tracing and what everything means. Here's a picture of your QRS for an EKG and what it looks like normally. The P wave is atrial depolarization. And it's the initial upward wave right where my mouse is. That represents the spread of depolarization from the SA node through the atria. The QRS complex represents the result of atrial repolarization and early ventricular repolarization, which is right here. The T wave right here represents or is the result of ventricular depolarization and repolarization. They can be affected and changed and not look exactly like this if you have issues such as bundle branch blocks, cardiac arrhythmias, some other stuff. Now we're going to get to abnormal EKG tracing. This is atrial fibrillation, ventricular fibrillation. Sorry, this is ventricular fibrillation. And cardiac fibrillation is the abnormal heart rhythm characterized by uncoordinated and chaotic electrical activity within the heart. It leads to ineffective contractions of the atria and ventricles, resulting in a loss of cardiac output and blood flow. Atrial ventricular fibrillation is life-threatening and requires immediate medical intervention as it prevents the heart from effectively pumping blood throughout the body. The interesting thing about ventricular fibrillation, if you look in V4, right where my mouse is, these 3 beats, to me, look more like VTAC than VFib, ventricular tachycardia. VTAC can also be life-threatening. VFib is a more life-threatening issue than VTAC would be. There's also another rhythm called torsades de pointes, which is as dangerous as VTAC and VFib, and all of them are a result of your heart having issues with cardiac conduction issues, and your rhythm gets thrown out of whack, and it requires treatment. Now we're going to move on to another potential issue, which is bradycardia. It's often caused by SA node dysfunction of the I'm going to call it the SA node, the sinoatrial node, your heart's natural pacemaker. It can occur when the SA node fails to generate electrical impulses at the normal rate, or when the conduction of these impulses is impaired. Bradycardia can be caused by various factors, including medications, electrolyte imbalances, or underlying medical conditions. It can also be caused in athletes while they're sleeping or resting and not be of any concern. If you are in very good health and an athlete, it's been very well documented that bradycardia is not uncommon and not a serious issue. Uh, the second strip is a sinus block, which can be another issue, and it looks a lot like a sinus arrest, where this long flat wave is essentially your heart going into cardiac arrest while it's in sinus bradycardia. Bradycardia can lead to the need for a pacemaker to be installed and implemented, and it will shock your heart and pace your heart if it goes into bradycardia in some people, while others are not symptomatic and don't have issues with it. Oh, and my conclusion is the cardiac conduction system is essential for the proper functioning of the heart. It coordinates the organized and rhythmic contraction of the heart's chambers, ensuring efficient blood flow through the cardiovascular system. The pacemaker cells in the sinoatrial node play a crucial role by generating spontaneous action potentials, which then propagate through the conduction system and trigger the coordinated contraction of the atrial ventricles. The electrocardiogram, EKG, provides a valuable diagnostic tool as it reflects your heart's electrical activity, with the P wave, QRS complex, and T wave representing different phases of the cardiac cycle. However, when you have abnormal heart rhythms such as fibrillations, and they occur, they can impair your heart's ability to effectively pump blood, leading to potentially life-threatening consequences. In such cases, immediate medical intervention may be required to help restore your heart's normal function and maintain adequate blood flow throughout the body. By understanding the intricate workings of the cardiac conduction system and implications of its potential dysfunctions, healthcare professionals can better diagnose, treat, and manage various cardiac conditions, ultimately improving patient outcomes and quality of life when these issues do arise. These are my references, and I would like to apologize for calling ventricular AFib. That's a mistake. Thank you so much for watching, and have a great day.